Peace and Pan-Africanism to all my African brothers and sisters from all around the world. Welcome back to King Says So. I'm your host, Kagiso Hlongwane. Host is in Jiva, Sono, and we're back at it again with another one. And this time around, I've got something special for you guys. With all of this drama that is happening in the health sector in South Africa, I thought maybe I should bring someone who is working in a hospital, someone that is working in a day-to-day life doing this health work. And I've got Deron. I wanted to say Taron. I have got my brother Deron. We met in hospital. I've got a family member who's currently in hospital, and that's where I met him. And when he said he's coming from Guyana, I was like, yes, we are winning. We are winning. We are taking over Northern Cape. Taron, if you had to introduce yourself, tell the people where you're from and everything, what would you say?
Welcome, as my brother said here, the king himself, the
Yes.
King Zinjiva, all the way from you know where. My name is Deron, originally from Limpopo, Guyana.
Yes.
Currently here in the Northern Cape.
Still
Western, Northern,
Yes,
Western, it's kind of
yes,
confusing sometimes.
yes.
But currently here in the Northern Cape, in the health industry, as he has already mentioned, we have met in one of the health facility, taking care or looking after one of his family member. So yeah, we are here today. I'm here today as he invited me, of which I feel so honored
Yes.
to be here with the king himself.
What are you doing at this particular hospital? What is your job there? So that the people can know when I ask the questions, then they know what is it that you're doing. Actually.
Currently, the particular hospital or health facility where I am, it's a very, very, very small thing that I'm doing. Not a doctor, not a radiologist or whatsoever. Just a general nurse looking at patients or day-to-day nursing or bedside nursing, as we call it in our health industry. So that's what we do, looking after these patients. And that's where we interact with a lot of family members and the patients themselves.
Yeah.
Making sure that they achieve their health or good health status before they leave for home. So yeah, that's what we do.
I'm gonna start at the beginning because I'm quite curious about nursing and whatever. And especially when I see male nurses, I'm very I'm like, did you grow up wanting to be a nurse? Number one. Number two, how long do you have to study to be a nurse? And is there levels of nurses or what is going on?
All right. One, as you've mentioned, that as a nurse, not just a nurse, but a male nurse.
Yes, a male nurse.
Something that it's even this day, it's kind of like okay, we do have male nurses and whatsoever, because the health industry or the nursing industry, to be specific, it's about it's dominated by females.
Yes.
Yeah.
So it's a mothering, nurturing.
It's kind of like a mothering, nurturing kind of a game, kind of a gift, or kind of a setting.
Yes.
But what we do there, as you said, how is it, or what it does, what does it entail? Day-to-day nursing care, giving general nursing to the patients as they come, as they are admitted in the hospitals. So it's quite an interesting job, as the way it is done. But it is different from the old days and these days. It is way different because things changes, technology comes in. You spoke of how long or what does one need to study, and all those things.
Yeah.
So studying for nursing, a general nursing, we've got categories, which is we have a registered nurse or professional nurse, and then we have
registered nurse. What is that? Break it down for us.
We have registered nurse or professional nurse, or we have enrolled nurse, or which we call staff nurse, and auxiliary nursing, or we also have auxiliary or ancillary nursing. So a professional nurse, when you go into a health setting, you will see those ones with maroon.
Yes.
I've
seen that.
Yeah, and then there are those ones with white. We call them epaulets on the top. They are white, and then we have.
I'll put a picture of those things.
And then we have auxiliary nursing, of which they do not have some sort of distinguishing devices.
Yes.
But with their category, yes, they are there. So we work.
Which one is the highest?
The highest is the registered nurse or the professional nurse, and then the
purple,
the maroon one.
Maroon, I mean.
Yes. And then we have an enrolled nurse, which is the white one.
Yeah.
And then followed by the auxiliary nurse.
There's no blue ones.
Now we do not have blue. The blue ones that you see, those are students.
Oh,
if you see anyone working at a certain health facility with a white and blue stripes, you must know that that is a nursing student.
Okay.
So coming to students, as you said, as you've asked, what
study?
The studying part.
How long?
How long? So before the curriculum change, it was 4 years.
Huh?
You study 4 years as a BK, and then the nursing is studied differently. There is a government setting where you study nursing. There is also privately where you can study at certain universities. Certain universities, they do offer nursing education or nursing courses.
Yeah.
But also government also offer those nursing courses
4 years
hospitals. So it was called D4 in a government setting.
Yes.
Also, the universities also adopted that D4. So that D4 actually stands for Diploma in Nursing, and the 4 stands for 4 years. So you do it for 4 years.
Oh.
So that's what happens. So you study for 4 years, and then you get those maroon applets.
Yes.
Now the difference is that in the government setting where you were studying, in they affiliated with certain hospitals.
So you can
you study. You call it. You have a diploma. Now that was before the curriculum change in the government setting, because many people were asking, how can you do a diploma for 4 years? But
it's long.
It's long.
Yeah.
4 years is supposed to have a degree.
I honestly thought you were gonna say 2 years.
No, there's a lot that you need to study in nursing. It's not just go there. As people see nurses going around, just looking at the patients, giving medication, but
there's a lot behind it.
There's a lot behind it. There's a lot that goes in there. And then
because a doctor is 60.
Yeah, doctors do medicine minimum 6 years. Yes, and then when you specialize, and then you go beyond that.
Yes.
Also in nursing, you can specialize, and then you go beyond that.
After you have specialized nurses.
Yes, we have specialties in nursing. So there's quite a lot of specialties. If you are interested in studying further and specialize, and then you are able to do so.
Heaven.
Yes, so there's quite a lot of work that goes in there. It's not just nurses going around and nurses going around doing that and whatever, but there's a lot that goes in, because you can't just go there, do nursing without knowing what you are doing, including medication and how to care for patients.
You kill people.
You will kill people. And these guys are very strict when it comes to these things. You will be charged, you are
gone. Your license will be
Your license will be taken,
and
everything that you know about nursing will just go into waste. So you need to know what you're doing.
Okay, before I get into what I want to talk about, the foreigners and everything, let me get into private versus public. Which nurses are working harder? Because the assumption out there is that these ones in the public hospital, they are cutting there. Seriously, you see the queues, you see the number of patients that they must meet, and you see everything. Are we getting paid the same, or what is going on? Private versus public. What is going on? What's the major differences and the major similarities?
Private versus public. Let me start with the workload before I come to the pay rate.
Yeah,
the workload is different, but when you look at the work itself, it's more or similar the same. But then let me start with public, because I've been in both industries, public and private.
Yeah.
With public, the workload is that you have to deal with too many patients almostly at the same time. And now the cause of this is because at public, given the level of the economy and the work that people have to go to do, many people are not working. Some are working, they cannot afford private. They cannot afford private health care, so they resort to public. So some those who can afford a little bit, they do have your medical aids.
Yeah, smaller.
So now the workloads in the public sector is that you have to deal with too many people at the same time. And the other advantage of being in the public is that you are able to interact with a whole lot of people. So if you are someone who is passionate about caring, you get lots and lots of health aspects and experience, and you get to know.
So diverse.
It's so diverse because you meet lots and lots of people.
Lot of sickness and a lot of scenarios.
A lot of scenarios. Some of these scenarios are like family related, so you are quietly exposed if you are much more interested in health. So the workload there is because you deal with a lot of people. The disadvantage might be that you might run out of resources to work.
Okay.
First of all, in our country, we have a problem with medicine supply. We have a problem with equipment, and comes with staff shortages. In most cases, you will find or you will hear staff shortages, and the nurse to patient ratio becomes short. You find that one nurse, for example, if I can give you an example, one nurse needs to take care of about 10 patients. And of which is a lot in one day to achieve or to achieve quality health care. To achieve quality health care.
Okay.
One nurse into 10 patients is a lot to deal with.
What is an ideal ratio?
The ideal ratio should be, according to me and what I've seen and the experience that I've had, the ideal ratio would be about 1:5. That would be better because you'll be able to achieve quality healthcare into those people, because it's not just giving medication, but you need to monitor. You need to go back. You need to evaluate. You need to check what I did. Is it working? And if it's not working, what else can you do to improve on what you just did? You know, it keeps on changing every now and then. So that is the kind of workload that you face in a public healthcare. Now, in a private healthcare, it's quite hectic, more than in the public.
Why?
The reason being that when you are in a public healthcare, people just come, and when they feel like they are not okay with this, they can just walk away and go to the next clinic or public hospital. But in a private healthcare, you're not just facing illnesses, you are facing behavior as well. You are facing behavior of a patient, behavior of a visitor or family member. You are facing behavior of the doctors as well. So now you're also facing the behaviors of the
dealing
owners.
with people now.
Yeah, because now this is a business setting that you need to know. The owners of the private healthcare, they will also be on you because they are running a business and they don't want to lose a business. And this is things
so, Tina, the people, the clients, we are the business.
You are the business, and we as workers, we need to make sure that business
customer is always right.
Customer is always right. You know it. Hey, you have it. So the customer is always right. So now we have to meet that standard, and everybody that comes or that goes into a private sector goes with that mentality that I'm going into a private sector, no matter how ill this person is. And that's the funny part, that things that we face. No matter how ill this person is. The first mentality that they have is that I'm going into a private setting. In a private setting, this is the kind of treatment that I'm going to get. Let alone I'm being sick. I have flu. I'm coughing. I need to get medication for coughing. I need to, get some injection for coughing or whatsoever. But the thing is, what they expect is the kind of a treatment that they need to get at the private sector is of first class. If I were to put it like that. They will forget about you having to give treatment. They will forget about you having to monitor them, whatever. But they will look at on how you treat. Like, if I can give you an example, if you go into a hotel, the kind of reception that you get in a hotel, the kind of
guest
service,
house. It's
not a guest house. The kind of service that you get in a hotel is different from the guest house. So in a hotel, you expect that you can just pick up a phone call, I want breakfast, and then they bring breakfast while you are there in your room.
Customers always,
as a customer. So those are the kind of challenges that you face in a private sector.
Salary wise, sorry to cut you. You can continue and then just check the salary.
And then the workload on
Yes.
Delivering quality healthcare, I would say it's better than the private because you have everything available almost immediately.
Yeah, at your disposal.
Yeah, medication, equipment, nursing stuff,
so that you can do your job.
to achieve that. So now the problem is the behavioral part is the one that is challenging in the private sector, because the business owners want to see the business running. They don't want people coming.
They don't want to hear stories.
They don't want to hear stories. If a patient comes now and then must receive good service, that patient must go and tell your king, you must go to the Ron's private hospital. Those guys are very good. So therefore, they run
strong referrals.
Yes, strong referrals. So that is the aim. That even next time when you get sick, you're like, I'm not going to King's Hospital. I'm going to the Ron's hospital. The service that I got there was excellent. So that is what we face.
And the salaries, the same or different? What's going on?
The pay scale is different, actually. Obviously, the pay scale, the private sector pays much better than the public sector.
Okay. Let's give people an idea. Let me say I'm getting paid 5,000 at public. What for the same job in public? Where will it be? Will it be 10 or 7, 8? What is just an idea?
Unfortunately, as a healthcare worker, I will not disclose much of the information.
Okay, I tried my best, guys.
But in that scenario, I will not disclose much of the information because okay.
I'm
back on giving healthcare service. Guys, what I can say is, it is different. The private pays better than the public. If you were to give a scale, the difference is not that much, but there is that difference. If in a public you're getting 6,000 rand, you can go to a private and you get maybe 7, 8, and the private has improved because back then people used to say in private you just get everything. The benefits there are not much and all those kind of things. But they have improved. The benefits are almost the same in the public.
Do you guys have medical aid?
In most cases, the private are insisting on medical aid.
They insist.
Yeah, in most
you must pay for it and get medical aid.
They insist that when you work in there, you do have medical aid. Okay. As an employee of the private sector. Some are compulsory. Public, it's your choice. Public sector is your choice. They do have workers anyway. Yeah, it's government workers. They do have medical aid schemes, but for you to join as an employee, it's your choice. But in a private sector, most of them is compulsory. As their employee, when you go in, you must take up a medical aid.
Okay.
So
because I was wondering when I see you guys running up in the hospital, I'm like, these ones, if they get sick, will they get the same? Where are they going?
Are they going to get the same service as they want? But you can just think of it. You are giving this kind of a service to these people, and then the next thing if it's your turn, you get the one is lowest. So that's why most of the private sector they insist. On a medical aid. So that's the thing.
Beautiful. Okay. No, I'm just chopping up the questions. So right now, sorry guys, I'm going to have to call this person back. That's the things about podcasting. When you are podcasting with your phone, people can call.
You can just say hala.
Yeah, people can call and just do whatever that they want to do and disturb you. You need to put your phone on flight mode, but these phones, they are so naughty. Sometimes these calls come in at flight mode when I want to sleep. Anyway, okay. So now there's a situation in South Africa. A situation in South Africa that our law is saying one thing, the citizens are saying another thing. But today on King Said So, we're going to hear from the people who are actually working at our clinics, our hospitals and everything, how they feel. Understand? There's a queue of you are in a particular hospital, you are in a particular settings. There's a queue. That queue has got 30 people. 10 of those people are undocumented foreigners. They don't have they are not here legally. Then 10 of the others are here legally. The other 10, they are foreigners, but they are here legally. And then the last 10 is South Africans, obviously, born here, everything. And you have to serve everyone as a nurse. How do you feel as a nurse? What is this doing to your psychology? And I'm giving an equal ratio here, but it's never equal, that ratio. It's usually more South Africans or more foreigners or whatever the case. What are the nurses seeing and how are they feeling about this thing?
The thing is, as a healthcare worker or as a nurse, it's a bit straining. We mostly find ourselves in this kind of dilemma where whether you do this, you are right, you are wrong, or whether you don't do this, you are right.
You're still right or wrong. Yes.
So now you need to apply that ethical dilemma and put it in a way that it can benefit everybody. At the end of the day, you as a healthcare worker, you can be able to be answerable to say, I managed to do this and do that, given this and that. And if you did not do, you will be able to answer and give reasons why. Because
why not? Yeah.
What people don't know is that nursing, it's one of the highly governed profession. It might not look like that in a public eye, but behind the scenes, we are highly governed, and there are too many policies behind that govern us as nurses on how to work.
Okay.
In the scenario that you're giving, you've got 10 illegal, 10 legal, and then you've got 10 South Africans. And you need to serve these people.
With limited resources.
Now, the dilemma is that one, that you as a South African, what are you going to do? You've got South Africans that need treatment with limited resources. And you've got 10 non-South Africans that are here legally with those limited resources. And then you've got 10 undocumented patients with that kind of limited resources. Now, when you apply the law when it comes to providing health, one of them says you need to stabilize the patient first. If you have enough resources, what you would do, this guy is not legal, what I'm going to do, I'm just going to stabilize him, give him something. If maybe he's bleeding, just make sure that I cover that bleeding to stop the bleeding whatsoever, and then let him go.
But that bandage, you are finishing it. I mean, I'm waiting for the bandage also.
Exactly. As a South African, you are waiting for that bandage. Now, one of the things you would consider, is your health problem the same as this one? Because obviously you would be coming with different health problems. So as much as I gave the example that you're just going to stabilize, make sure that the patient is stable before. Like, for example, even if you say you come alone, you are undocumented, and then I have abundance of resources, I will ask for your documents and say, okay, I don't have documents or whatever, but I'm bleeding. So what?
I'm
pregnant, or things like that. What is the thing? What must I do? Okay. That is the dilemma that we're going to
Let me ask this before you continue. Yes. When they say they are undocumented, when they come to the hospital, the clinic, they are producing nothing to you to write. When they say I am Sylvia Lucas or I am Kagiso Hlongane, do you just write what they are saying, or do you want something, or what is it? What is an undocumented person presenting in the clinic, in the hospital?
An undocumented person that presents themselves in the clinic or hospital in most cases, they bring nothing, but only the information. I am Deron, I am bleeding, or I'm coughing. Yes. And then we ask, okay, what are your full names? Give the full names.
How old are you?
How old are you? Your address. Is there anybody that we can call on your behalf? We need that kind of information. That will give us a baseline of who you're
taking everything I'm saying.
So we ask. So unfortunately, we have to take everything that you're saying because that's what you're giving us.
Yes.
Before we treat you, we need to follow. Remember, we keep records. And the purpose of record keeping is to make sure and do follow-ups. Yes. We can refer back the next time you come. Yes. Or also for statistical purpose, that the healthcare industry has treated 500
foreigners.
non-documented foreigners.
Okay.
And compared to the South Africans, we have treated 100
Yes.
South Africans, and we've treated 500 non-South Africans. That will give them, in the health perspective, that actually who is more sick? Is it
Foreigners
or South Africans?
Who are we saving more?
Who are we saving more?
Okay.
So that's one of the reasons that we asked that information. And then if you go on to statistics, that's one of the reasons that they keep this kind of statistical information. So now
it directs budget also.
That also impacts on the budget.
Yes.
Yeah, when they have to allocate funds for the health industry, they will know that these funds.
Look at the stats.
Yes, in the states. Our South African people are actually not
getting the medication
as they're supposed to be. The people who are actually getting medication are the foreigners. Or our South Africans are the ones who are getting more medication than the foreigners. We are treating more South African and less.
Or vice versa.
Vice versa.
Yes.
So now, these are the dilemmas that we face as health workers. Just to touch back on what you asked, if we have 10 non-South Africans, 10 documented and whatever.
Yes.
But the bottom line is you have to stabilize. After stabilizing, when you get the information, you will have maybe a non-South African, documented non-South African. For example, you stabilize the patient and then you check, is this person, can this person afford? And then where are you by that time as a health worker? Are you at the private?
No, I'm speaking strictly for public, because there is no non-documented people in the private sector.
Private sector.
Yes.
Yeah, but then that again, that's another thing. You can have a non-documented person in private sector.
Who pays?
Who comes and wants, okay, I have cash, I'm sick.
No, people, wait. No. Daron, what are you saying now? I can come as a non-documented person.
You are
to
here.
A public hospital.
I'm going to give you a simple example.
Yes.
Let's take you and me. I'm here, non-documented. I have cash. I am bleeding. And then
you are in a medical emergency.
I'm in a medical emergency, and then I'm put.
You need help now.
I need help now, and then I run into a private sector, because me being undocumented does not mean I don't know about public and private. I know that about public and private. I know there's private, and there's public, and there's private.
Yes, but because you are married.
I'm just here undocumented, and then I have cash, and then I need immediate help. And remember, these people, they're just like anybody else. They have information.
Yes.
First of all, the very same patients, they have information about public and private. They know which one offers quick and better quality health care. So if like, okay, fine, I have money. I know I'm not documented, but my health needs immediate help.
This is a serious thing. My wife must give birth now.
My wife must give birth now, and I have money. I'm taking her to the private health care. That's where your human rights comes in first.
You can't turn that person
You cannot turn them back. When you have those human rights governing you, you can't turn the person back. And then this person is coming, I'm not, my name is Deron. My wife is... Cynthia. It's Cynthia.
Yeah. We need help.
We need help. She's about to deliver now.
How much?
How much?
Tell me how much.
Yeah, you are at an emergency department. How much? Say, where's your ID? I don't have an ID.
I've got a card and I've got cash.
I have cash. I can pay cash. I don't have an ID.
It's the first time I hear this.
You think those people, they will say, no. With your wife, go and give birth at the streets. What if that person comes, let me just say, head on perineum?
Yes.
Yeah, the guys there, they assess head on perineum. That's where the nursing dilemma comes, because in a private setting, there are those people who are supposed to take your information, even in the public hospital. Yes. Your clerks, your admin clerks, they will take your information and whatever. Now, who is right, the admin clerk or the nurse? The nurse will be there looking like, this person, the head is about to be out.
It's time. But this person is dying.
The admin clerk says, I want your ID. I want your information. You don't have. You are not. You are here in South Africa.
Illegal.
Undocumented.
Yes.
And you have someone who wants to give birth.
And I just shut that admin clerk up with a swipe of money.
And then you just say, I will pay.
Anything. I will pay. Just pay. Madam, I will pay, madam.
You see now. And then you have the bosses, of which are running the private hospital. What do you think the boss will say?
If I'm the boss, I'm saying, let that person in.
Obviously.
He's paying.
Yes, the boss will say, no, treat him, let the wife deliver everything. After delivering,
everything.
Then they can go. What does the healthcare law says? Stabilize the patients, then go. But then the human rights also says you can't just. But then again,
you can't allow people just to die.
Yes. But then again, you have this one who is undocumented. You want to take names and whatever, you want to keep records.
You don't have.
Who are you treating? You don't know this person. What if I'm giving you a wrong name? What if I'm giving you whatsoever? What if I'm being wanted for stealing, for killing, for whatsoever? And then
what if I'm a dangerous person towards
you elsewhere? You see, so those are the kind of dilemmas that we face as nurses. But unfortunately, the constitutions, the human rights, and all those kind of governing bodies, they give us that kind of dilemma to say, you can treat. If it's a public sector, they will treat you, they will get everything, whatever. Because now, the constitution,
they are operating more on the constitution.
You will get there. But then as a South African, if you are a South African nurse, because we do have non-South African nurses. Yes. But obviously they are being governed by the South African nursing governing body. So they have to adhere into what South Africa is saying. Now they also find themselves in a dilemma that this is my fellow countryman. He is here undocumented.
So they'll give him information, say, hey, we must help you actually.
You can't just let your...
I mean, now if I'm a South African and I'm working in Zambia and there's a South African coming in there, documented or non-documented, I'll say, hey, man, we actually can help you. Do you have the money?
Do you have the money? All those kind of things. So that's where sometimes corruption happens. But corruption will happen at the higher stage because you will consult to say we have someone who's undocumented here.
Or you consult, you can't make the decision as a
we
nurse.
don't make the decision.
You as a nurse, you'll be just serving.
We just execute, we just serve.
Yeah, because they've been clocked in, they are in, they've been checked
and
in.
And then those up there will be like, look, let's just treat, because we can't just let the person die in front of us. Let's just treat this person.
And they bring the law, they say.
And then the laws will come in place. So it's kind of a, hence I'm saying the nursing, it's way more than what people see in front, So there's a lot that's happening right there.
Okay, what is without disclosing too much, I ask myself, how do nurses deal with seeing people die on a weekly? Because you are there trying to stabilize this thing, this person, this person. I'm saying this thing, but I think it's just sitting. Just sitting there. We are Faromuntu law, and it can't breathe, and you see this person has taken the last breath. And you are there. Does it get better over time, or because you are connected almost to every patient that you are working with, it gets worse over time? What do you guys feel when there's both? There's this foreigner that you're trying to assist, and the foreigner gives birth, but she passes away, or the child passes. What is going on in your psychology as a nurse in that regard?
That's one of the things.
Do they teach anything about that?
One of the difficulties that you face as a healthcare worker.
Yeah.
And it's one of the things that you can't run away from.
Yeah, it's there.
Yeah, it's one of the things that you need to face. That one of the things that you come across on daily basis, actually, and not just about a person dying or seeing someone die in front of you, but there are a lot of things that happen. Someone comes in injured badly. For example, this kind of car accident. Someone comes, maybe the eye is out.
Yeah.
Just to give an example.
Yeah.
From the accident, or the skull is open. No. So the psychological part there is the one that you need to deal with. It's a difficult thing.
How do you guys sleep?
So I remember one of the visitor once said to us, she was like, "You guys, you act so normal, yeah? And I'm like, what do you mean we act so normal? And she was like, you guys act so normal. You know, I was at this other ward and somebody died and I see everybody, they look a bit scared.
Okay.
And you guys just continued and do your job, and you even laughing and whatever. You act so normal. How do you do this? And you see, as much as you're asking now, everybody's asking that question. How do you guys do it? Do you even have feelings? Do you sleep when you get home? And all those kind of things. But the psychological part of it is that you get used to it, but there are some point where we crash. And I can tell you, and I can promise you, sometimes we even cry behind closed doors.
Jesus.
That is the truth of it. We even cry. Like, I'm not talking about crying like
weeping.
I'm talking about crying, weeping, crying tears out on duty. But there's something that you can't do in front
Guys, Amanes are going through the most.
It's something that you can't do in front of the patient, in front of the
Clients.
visitors, or in front of the client, or whatsoever.
You must get your little corner there.
If someone dies, depending on what was happening or what was the condition, because there are too many aspects: the age, the nature of illness, you know, how did it come to be that person end up in hospital? That is one of the things that we face. We will deal with that incident at that moment, but I can tell you, you see one person, one nursing disappeared and come back after 2-3 minutes.
You must know.
You must know that one went to wipe the tears.
I'm not laughing.
And I'm telling you, this is not a family member that I'm talking about. It's just a general patient that I don't.
Because you guys are so passionate and so connected.
You
to
are
your
so passionate.
people.
You
are
connected
human.
to your person. And then at the end of the day, you are human. Like I said, the other things that you look at, the age, the nature of the illness,
all considered.
Why is this person here? You know what I mean? So those are some of the things, and some of the situations that makes people cry or nurses cry. It's not just about death, but the condition itself. You know,
they saw someone
you
suffer.
find someone.
This person suffered to death.
You're seeing someone suffer to death just when you think you are achieving something with this person, and then the condition changes and then the patient passes away. Today you admit the patient now this morning, and then you knock him off this morning from night shift. When you come back later at night, that patient passed on.
When are you thinking I'm going to see Mama or Papa or Buti Ban again?
And now you see, that's another thing that comes in. You have to deal with family members.
Oh, now I'm crying now because my whoever has passed away. You have to do me and console me.
That time, that thing has hit you so hard as a nursing professional.
We're crying together.
Now you need to
be strong for me.
Comfort. You need to be strong for this one at that moment, because this person is there at the hospital with you. And worst part, you have to deliver the news to this person to say, look, I'm sorry, your loved one did not make it. We tried our best.
Do you deliver news or not like that?
Not exactly like this, but you need to find a way to deliver. But if it's
I'm asking, is there a specific person who's the messenger?
We do not. There's no specific person who's a messenger.
You
as a healthcare worker,
you must be able to deliver those.
You must be able to deliver those things. Although there are, certain educational
aspects to it
to say this is how you can deliver this message to a family member, so that. But to deliver death to someone, no matter how you deliver it,
it's death.
It's death.
Finished.
So there's no way you can expect, I delivered it in
a smooth way. Yeah.
Then they will take
that is someone's father. That is someone's mother,
brother, sister, child, and stuff like that. And when you're speaking of a child in the health industry, you lose a 2-year-old. What do you think it does that to you as a nursing person? You lose a 1-year-old or a 3-month-old baby. What do you think that does psychologically as a nurse, as a parent? Someone just celebrating giving birth to a son or to a daughter, and then all of a sudden, 2 months later, you're losing this child. Because some are passionate about this thing. They want to work with kids only.
Yes.
They
love kids.
They love kids.
They love kids.
So imagine someone working with kids who loves kids that much, and then you lose this little one. What does it do? And you remember, this is not the first time, and it will not be the end time. It will not be the end.
The last time, yes.
So this psychological part of it, it's very tough.
Forever. And you find people that they've been doing nursing for 30 years.
Yes. So if you ask this person, I mean, in 30 years, you ask, how many have you seen go down?
They lost count.
They've lost count. Some of them, it affects them psychologically. So as nurses, we are able to identify one of our staff who has been affected by the health industry for a long. And these people, I can promise you, they cannot live out of health industry. They are there. They will always be there. But you can tell this one has been affected by.
But normal life, dollar.
Normal life out there, you can tell this person, since they started in the nursing industry, they have changed. They've become this. It is because of what they are facing at that point. The illnesses. Imagine someone now at the age of 30 coming in and suffered stroke. They can't talk. They can't walk. They can't
young
eat.
Person.
Someone who's young at the age of 30. Then just when you think of, okay, he's getting better, and then it hits him again on the other side.
Hey!
And then this person can't do anything anymore.
Can't lift a finger.
Can't even do anything. It's just there, looking at you. And looking at you, not like looking at you like this, but the eyes are just open. And then you wonder. Someone who's 30.
Yeah, is this
can't
life?
do this thing. You can't do anything anymore. Can't walk. Can't even raise nothing. Is he or she going to live like this forever? How is the family going to deal with this kind of person forever?
Ron, I am gonna invite you again, but in closing of this first episode, because every time when there's something health happening, I'm going to call you and say, "Are you free? Come, let's talk about it." In closing, I'm looking at what is happening in Durban. I'm looking what is happening in especially in Gauteng, where civil movements are going and blocking people from entering hospitals and clinics and all of those things. South Africans complaining about not having access to healthcare because of the overburdened health sector. You as nurses, you can't speak for all the nurses, but would you want a situation where government says you only help people who are here legally? Or does it not matter to you guys who's walking through the door?
That's a very, very sad situation to see it happen in our country, to see something like that, where the community is now revolting against foreigners. Let me just say foreigners, doesn't matter whether they are here legally or not, revolting against foreigners in healthcare issues. Number one, we've got nursing personnel that are non-South African. That includes doctors and nurses that are not South Africans. And
that's another topic.
They are delivering healthcare to South Africans. One will give the reason to say they are being paid. So they have to. But then again, that person who is here, who is non-South African and working as a healthcare worker, that person is supposed to deliver quality healthcare
to everyone.
To everyone.
Including South
Africans. Now, for non-South Africans to do that, it's very sad. And then to us as healthcare workers, to see it happening, is not a good thing. Because when a person comes and needs help, we don't ask, are you South African or not? We ask, what's your name? Where's your address? What's your ID number? And all that. Of which those are the things, that the information that we are required to obtain from each and every client. So now, the fact that our community is revolting against non-South Africans, or the health industry treating more non-South Africans than South Africans, it goes in long way. You have to look at supply of medicine, supply of equipment. There's what we call availability of resources. You look at, there are quite a number of things, your particular principles, your patient's rights. Those are the things that you're going to go look at. If you have to treat a patient, or 8 line, and I do not have enough resources, it goes back to the first question that you asked. What are you going to do? Some will say charity begins at home. Am I looking at my people first before these ones? Doesn't matter whether you are legally documented
or not.
Am I treating my people first before those ones?
Or do you see everyone as a client?
Or you see everyone as someone who needs a healthcare worker? But our people will revolt against this thing because of the way the healthcare service is being carried out. And as you said, this is another topic to discuss on another day because there's a lot of things that goes in there. I'm just a nurse. I'm not someone who's in health ambassador or whatsoever. But there's a lot of things, and as a nurse, you get to know these things. Because the thing is, you must look at why are our people saying non-South Africans must not be treated. That is the bigger question. Are people just waking up in the morning and say, our health industry is helping non-South Africans first before South Africans? There is something behind that.
Scarcity of resources.
There is something, and which is more than scarcity of resources. There is a main source, a main cause into that thing. And we as healthcare workers, we find ourselves
in the middle,
caught in the middle of these things.
Yeah.
You see, the law...
Because I saw a video, they are pushing another nurse. Hey, don't help this one. Don't help this one.
Help this one. Don't help that one. Now, who is running the healthcare industry? The community or the government? Or the nursing governing body? Because we have the nursing governing body. We have the Department of Health. And then there is the community. Which one is right?
Eish.
At this moment in time, if we have this kind of situation in our country, which one is right? Is the community right? Or is the health department right? What about the nursing governing body? Because there are some practices or law practices that we're supposed to follow.
You cannot avoid.
You cannot
as
avoid
a nurse.
As a nurse. And you as a human being, what does it say
to you?
If I receive 5 non-foreigners right now, I mean, non-South Africans right now, they are coming in wanting health. And there is a non-South African who is coming. 5 clients coming consecutively. And then there is non-South African that is coming.
One South African coming.
Let's say none.
Okay.
In the next hour. Am I supposed to delay them until
I see? Oh, you mean
none?
Yes. There's no one that's coming in.
No one.
There's these foreigners here. They came early because they can wake up.
Let's say they came early because they can wake up.
Yeah.
Or maybe it's just during the day. It's not busy. And then you've got 5 clients, and then when you check, they are not South Africans. And then amongst these, there is no South African that has come in. What are you gonna do?
You're asking difficult questions.
That's the thing. Those are the things that we face. Because in this kind of situation, we need to ask ourselves that if we say non-South Africans should not be helped first, but because I'm saying this because it does happen.
Yeah.
You are at a clinic, at a local clinic. It's not busy. Client 1 comes. Client 2 comes. Client 3 comes. Client 4 comes. Client 5 comes. All of these, if you check, they are foreigners.
Documented or non-documented, it does not matter. They are foreigners, these first 5.
These first 5. There is no South African. Are you going to delay them until a South African comes?
Some people will say that.
Or are you going to help them?
Some people will say, wait.
Given this current situation where our community is saying, people, let us treat South Africans first.
Yeah.
And then you have these 5. You see, that's one of the things that we need to understand. Because it's a difficult situation. Hence, I say, as nurses, we find ourselves caught in between, caught in the middle, because what are we going to do if we are faced with that kind of situation? And then you have community members. If I take one of the community members and say, okay, you say we must not help non-South Africans. Yeah, I have non-South Africans. I have not received a South African yet.
So
and
far,
they need help. I do have resources.
In this hour. I must not work for this hour.
What must I do then?
Well, South Africans will say, don't work.
Obviously, they will say, no, they must wait.
Yes. That's what they will say.
For how long? And then a South African comes, and what do? I have flu, I just have cough. They all just need Panadol. This one here is struggling to breathe. It's running out of air. Needs serious attention.
Needs to be stabilized. It's
Needs
not
to be
well.
stabilized. It's not well. And then you have someone who just needs Panadol, for example, who's a South African. You can't, like you always said, you can't just turn everybody back. And then you have someone who's a non-foreigner, who's running short of breath.
No, I understand what you're saying.
Who's bleeding. So now it's a very, nursing is one of the difficult industries to be in.
Wow. Okay.
But because, we need to work, and if you have passion for that, you're going to do it.
Guys, okay, this is episode 1 of Daron. Daron is here. He's in the health sector. He's been working in the health sector for how many years?
14 years now.
Daughter. 14 years.
Yeah. Been in the health industry for 14 years.
Yeah.
Is it 14? Or am I lying? This is 15 years this year. Started in 2011. Yeah. 15 years
2011 now. Or it's more. Yeah.
Yeah, it's 2011.
Yeah.
So that's now 15 years
Yeah.
now. Although there are those who have been in the industry for more than...
No, 15 years is a long time, my brother.
It's a long time.
No, that's a long
And you are
time.
exposed to all these kind of things and everything. So, episode 1 with Daron. Keep watching. We'll be back again.
Yeah.
We'll talk some more.
Yeah.
I may not be able to answer all the questions and everything, but questions asked, pose them, let's talk.
Yeah, pause them, guys, and I'm trying to get him to open his own channel also, so that you can attack him also that side and question him, so that you can be more informed with everything. But I'm gonna try to get him here at least once a week for you guys, so that we can get to the health matters and we don't make the videos too long.
Channel coming up soon.
But it's coming for sure.
It's coming for sure. Channel coming up soon. Stay tuned. Daron. We will talk some more, and surely there are so many things that we need to talk about. Health issues and whatever that you can think of. But currently, here with the king himself, we're talking health issues.
Yes.
Once a week, probably, if by popular demand and whatever, and then we can make it more time.
Yes.
And make the time a bit more short. And we can have people asking, you never know, we may go live and having people pose questions. Some might have sort of input, not only questions and everything, just to enlighten everybody. And everybody can see and know what is it that we are going through. It is being said so many years that nursing has gone to the dogs. As people have said, some will say nursing is a calling. Many people are there for money and everything. So there are just so many things. So we try and outline all those things. If nursing has gone to the dogs, why, who, and when was it taken to the dogs and all those kind of things. So stay tuned. But channel coming up soon with me Daron. We have so many things to discuss. Stay tuned. And bowing out with the king himself.
Peace.
Peace out.
Pan-Africanism. I salute you guys.